educate the community, that they will be called upon to be change agents regardless of where they are. And so we believe that every member of the fellowship should have the opportunity to take a piece of health information, public health information, and create an awareness for it, and then communicate that to members of the public. So my name again is Rami Azuine. I'm the lead faculty here, and I would like to welcome everyone to today's event. I get really excited about this event because I know all our fellows work really hard, and they get really hard comments from us on how to improve these presentations. The world, since COVID has gone digital, has gone remote. So ordinarily, they will be in Riverdale Park behind the University of Maryland in College Park, delivering these activities, this programming. But because we live in an uncertain world, they are beginning to do this regardless of where they are remotely. But these are as impactful as they could have been where they be in Prince George's County, where GHEP is located. So please, without much ado, I would like to hand over to group number 1. And if you start your group, please take quick opportunity when it gets to you to introduce yourselves and tell us your programming. And at the end of your presentation, we're going to have time for members of the community to take questions. I begin with the questions. Anybody who has questions can also ask them. So I'm really excited. Group 1, take it away.
Thank you so much, Dr. Azuine. Let me quickly share my screen. Can you see my screen? Sorry, can you see my screen?
Yes, we can.
Okay. Hello, everyone. Welcome to today's presentation. On behalf of Group 1, we are going to be talking about understanding diabetes, strategies for prevention and care. My name is Beverly Keguna. I have a master's degree in public health. I'm an intern with GHEP. The presentation outline will be overview of diabetes, types of diabetes, causes, risk factors and complications, signs and symptoms, global burden of diabetes, prevention and treatment. Now, as an overview of diabetes, diabetes is generally known as a metabolic disease. It affects the body and the way the body converts food to energy. It also leads to very serious damages in the body, which includes the organs of the body. There are 3 types of diabetes we want to talk about today that we'll be talking about. We're talking about diabetes insipidus, diabetes mellitus, and diabetes due to pregnancy. Diabetes insipidus, it's an uncommon disorder and it causes fluid imbalance in the body. Now, there are 2 types. We have the central diabetes insipidus and the nephrogenic diabetes insipidus. With the diabetes insipidus, there is lack of antidiuretic hormone. For the central diabetic insipidus, this lack of diuretic hormone does not allow the kidney to absorb amounts of fluid and salt, which the body should actually need. And so there is excess urination. Just the same amount of water that the patient takes in is the same amount of water the patient brings out. On the other hand, in the nephrogenic diabetes insipidus, the kidney cannot use antidiuretic hormone. And so you still have the same excess urination. We have the diabetes mellitus, and there are 2 types, type 1 and type 2. In type 1, the body does not make insulin. It is rare. It occurs in about 5 to 10% of patients. It has acute symptoms. It will usually start with children, from as early as when the child is born, and it continues through life. It is, however, controlled through continuous injection of insulin. With the type 2 diabetes, this is the type of diabetes that is more common. It occurs in 90 to 95% of sufferers. It has chronic symptoms. You mostly see it develop in adults after 45 years old, although some children, teenagers, and adolescents also come up with diabetes mellitus type 2. It could be delayed or prevented through lifestyle changes. Now we'll go to the diabetes due to pregnancy. We have two types. We have the gestational diabetes mellitus and the transient diabetes insipidus due to pregnancy. Now, with the diabetes mellitus and diabetes insipidus we have talked about, we have those two hormones being deficient. In diabetes mellitus, we have the deficiency of the insulin hormone, and in diabetes insipidus, we have the deficiency of the antidiuretic hormone. What are the differences? The difference is that with gestational diabetes mellitus, it occurs in about 15 to 25% of pregnant women. It is the most common type of diabetes. Generally, diabetes mellitus type 2 is the most common type of diabetes we have, and it results due to glucose intolerance. Now, it could reoccur in life. So if a pregnant woman, comes up with diabetic mellitus, there are high chances of you seeing this trend of diabetes mellitus later on in life. It has short and long-term implications also. With diabetes mellitus, there are high chances of developing breast cancer, reproductive disorders, and cardiometabolic diseases. And so it is a very, it's a very deadly kind of disease. And then we have the transient diabetes insipidus in pregnancy. It's rare. It develops usually in the third trimester. It is challenging to diagnose. You usually will not diagnose it. It occurs in about 2 to 4% of pregnant women. It comes up as a result of excess vasopressinase, that is excess antidiuretic hormone. However, this kind of diabetes, after 4 to 6 months of pregnancy, you don't see it anymore, which is different from, diabetes in mellitus that will reoccur in life. I'll now hand over to my colleague, Etha, to continue. We cannot hear you, Etha, please. Can you unmute?
Good afternoon or good morning, everybody. My name is Era Johnson. I have a PhD in public health, and I'm a public health fellowship. I'm doing my fellowship at the GHEP. In the next slides, we are going to highlight the causes, the complications, the risk factors, and the symptoms of diabetes. Diabetes can be inherited. In the cases of type 1 and type 2 diabetes, the pancreas makes excess insulin or no insulin. For diabetes insipidus, it's a result of it comes from pituitary gland disorders. And then, of course, you have having blood sugar levels which are higher than normal. And then, of course, if you are not able to manage your pre-diabetic stage, you can be a diabetic. The CDC highlighted various complications resulting from diabetes, and these include cancer, nerve damage, vision loss, hearing impairment, prolonged or inability of injuries to heal, heart disease, poor oral health, chronic kidney failure, mental health instability. The risk factors include being pre-diabetic. If you are pre-diabetic, you like I said before, you can become a diabetic. If you are overweight, which is probably BMI of 25 and above, you can be diabetic. And then the age, if you're 45 years and above. If you have a parent, a brother, a sister who are diabetic, you are at high risk. If you are physically inactive, which means if you are exercising less than 3 times a week, Then also, if you've had gestational diabetes during pregnancy, or if you birthed a baby weighing 9 pounds and over, you can be at risk. And then certain races, such as African Americans, Pacific Islanders, Hispanics, American Asians, American Indians, Alaska Natives, they are also at high risk. Next slide. The symptoms of diabetes takes years to develop, and you may not notice the symptoms until adulthood. And because of that, because they are very difficult to spot, it's very important that people know the risk factors. It's also very important that people know to get their sugar levels tested, because early detection and treatment can minimize or reduce the risks to being a diabetic patient. Miss one slide. Some of the common symptoms include frequent urination, mostly at night. Some are feeling very thirsty, feeling very hungry, being extremely tired, blurry vision, slow healing cuts, wounds, bruises, tingling, pain, or numbness in feet and hands. I'll now hand over to my next colleague, Bernard, to continue.
Thank you, Etta. My name is Bernard. I hold a master's degree in environment, and I am an intern with Global Health and Education project. Basically, I'll be taking you through the global burden of type 2 diabetes. The map here shows the prevalence of type 2 diabetes across the world, across the globe in different regions. The different colors here signifies the different burden, the amount of the burden of, or the prevalence of type 2 diabetes across the globe. More recently, about 537 million adults have diabetes worldwide as of 2021, last year, while 783 million is the expected increase by 2045. 224 million people are at high risk of developing this type 2 diabetes, as reported by the International Diabetes Federation in 2021. This graph here shows those who are at risk in terms of ethnicity, race, ethnicity, and it shows that the American Indian and Alaska Native are high risk of this type 2 diabetes. This is a 2017 diabetes burden statistics globally. Globally, there was in 2017, the prevalence of type 2 diabetes was 6,059 per 100 cases, while the burden of suffering was 751. Now, among the European countries, Netherlands has the highest prevalence with 11,244. And for the burden of suffering, Italy has the highest number. Next slide. Among Asia has, in 2017, the Asia continent region has 5,961 prevalence per 100 cases, per 100,000 cases, while the burden of suffering was 729. So among these countries in the Asian region, Taiwan has the highest prevalence of 10,012, while the burden of suffering is still the Taiwan, which still has the highest with 1,294 burden of suffering. While among the Australia, which is a kind of a continent on its own, it has a prevalence of 5,205, while the burden suffering of 503. Now, in the American region has a prevalence of 7,060, per 100,000 cases, while the burden of suffering is 1,036. So, but among these African countries, United States, Canada, and Brazil were chosen as a case study. And United States has the highest prevalence among the countries, which was with 8,911 prevalence per 100 cases, while the burden of suffering too was still highest in United States among the 3 American countries. In the African region, Africa has a prevalence of 3,916 per 100,000 cases, while the burden of suffering is 537. However, South Africa was chosen as a case study for this presentation, and it has a prevalence of 7,360, while the burden of suffering is 1,274. The previous slide shows a statistics of 2017, but here is the most current one, which shows statistics in 2021 as reported in 2022 by the International Diabetes Federation. And it's according to regions. The highest prevalence was seen in the Western Pacific, with 206 million people suffering from type 2 diabetes, while the least was seen in Africa with 24 million people. This table shows the estimated prevalence of diabetes by 2045, that is the projections, and also shows the undiagnosed rate among these regions, the death rate, and also the expenditure involved in type 2 diabetes. Among all these regions, the Western Pacific, which previously shows the highest prevalence, is still showing the highest 2045 projections with 260 million, while the least is seen in South and Central America with 49 million. But in terms of undiagnosed rate, Africa has the highest. For the death rate, the Western Pacific still has the highest death rate with 2.3 million. Now, the cost expenditure among this region, the Western Pacific still has the highest cost expenditure with 241 billion. In summary, type 2 diabetes, globally, among 12 people, 1 will have diabetes. How many of us are in this presentation? We're about 17. So this shows that probably one of us must have this type 2 diabetes. And it's surprising to know that people who have this type 2 diabetes, at least 1 in every 2 will not know that he or she has the type 2 diabetes. And it's very unfortunate that one person dies of type 2 diabetes after every 7 seconds. That is an estimated value of 5 million annually people die from type 2 diabetes. Well, like people living with this type 2 diabetes, about some 7% of them are from the low and middle income countries. Thank you. My colleague will take over from me here.
Good afternoon and good morning, everyone. My name is Marilyn Murillo, and I have a doctorate of education degree. And I will be talking to you about the importance of diabetes prevention and treatment. Next slide, please. In order to prevent diabetes, very important that we lose weight, that we have a healthy diet and exercise regularly, be active. And if we are smoking, we should stop smoking. That is a high risk for diabetes. It is also very important that we see our doctor regularly for our annual health checkups or semi-annual checkups, as well as have our cholesterol tested and our blood pressure tested. Again, high cholesterol and high blood pressure are other risk factors for diabetes. Next is what is called an A1C test. What that is a test that measures your average blood sugar over the period of the last 3 months. And just to give you an idea, an A1C test below 5.7% is considered normal. Between 5.7 and 6.4% indicates you have prediabetes, and 6.5% or higher A1C test indicates you have diabetes. So your doctor will order these tests to monitor your blood sugar levels, as well as your doctor will order fasting blood sugar tests, which test your blood for the previous 12 hours when you have not had anything to eat. Again, exercising more often is very important. There's different types of exercise. There's walking, aerobics, stretching, bicycling, and swimming. Now, your country, because this is a global presentation, your country may have a diabetes prevention program. For example, in the United States, there is a national diabetes prevention program. And the National Diabetes Prevention Program is a partnership between public and private organizations that works to prevent or delay type 2 diabetes. And partners make it easier for people at risk for type 2 diabetes to participate in evidence-based lifestyle change programs to reduce their risk of type 2 diabetes. Next slide, please. And also important in diabetes prevention is portion control, eating less, as well as eating less red meat and skinless chicken breast. The skin on chicken has a high fat content, as well as eating healthier foods, fresh fruits and vegetables. Now, a lifestyle change program is very important, and that's to help people learn how to change their behavior, eating healthy foods. That has been proven to prevent or delay development of type 2 diabetes, according to the International Diabetes Federation. It's also important to drink more water and have restful sleep. And then we need to watch our intake of carbohydrates, because that type of food quickly changes into sugar. So that means we should eat less breads, less tortillas, less naan, less rice, and we should avoid pastries and desserts. Next slide, please. Now, also important when we're discussing diabetes prevention is the types of interventions that are cost effective. So how cost effective is primary prevention of type 2 diabetes? Well, there was a study done in 2016 by the International Diabetes Federation, and they looked at these 5 separate interventions. If you see at the bottom of the screen, nutrition alone. So if people just change their eating habits, how cost effective was that? If there was a comprehensive lifestyle change only, there was another small improvement. If there was just physical activity, a higher cost effectiveness. If there was just medication, a little bit higher cost effectiveness. The most cost effective primary prevention of type 2 diabetes is comprehensive lifestyle changes, changing how you eat, exercising, all together, seeing your doctor, having your medication. And next slide, please. Again, with prevention and treatment, if you have diabetes, it's even more important to see your doctor regularly, your health appointments. These may be quarterly appointments every 3 months or every 6 months. Some people see their doctor monthly, so that your doctor can order these diabetes exams and laboratory tests to monitor how your body is progressing having diabetes. It's even more important to check your blood sugar regularly. Some people check their blood sugar before every meal, 3 times a day. And then your doctor may prescribe medications and insulin treatment. And if you have diabetes, it's extremely important that you eat healthy food. Again, as we discussed earlier, the healthy food, healthy fruits and vegetables. And healthy feet is very important if you have diabetes. It's very important to check your feet. And diabetes, unfortunately, is a major cause of amputation of toes, feet, and legs. So diabetes socks are very important because they help improve blood circulation. And Also, you want to have annual diabetic eye exams so that your doctor can monitor the impact that diabetes is having on your vision. Now, in some developing countries, they lack a lot of technology. So the World Diabetes Foundation has provided what is called a diabetes compass for developing nations. And what the diabetes compass is it's digital support to help healthcare professionals and people with diabetes to improve health outcomes in these low and middle income countries. Now, there's a need for more healthcare resources and trained staff to help prevent and treat diabetes in developing countries, and the World Diabetes Foundation is making an impact there. Next slide, please. In conclusion, we'd like to thank the team for presenting this presentation for you today on diabetes, and thank you, the audience, for attending. In today's presentation, we have discussed the overviews of diabetes and the different types of diabetes, the causes, the risk factors, and the diabetes complications. We've also discussed the signs and symptoms of diabetes and the global burden of diabetes as demonstrated through these statistics that we have shown you, as well as diabetes prevention and treatment. At this time, we will entertain questions from the audience, and I believe we have our moderator available to recognize you for your questions. Again, thank you, and we look forward to having a conversation with you today.
Thank you so much, Group 1. May I invite everyone to use your reaction button and join me to send kudos to Group 1 for an excellent presentation. In your reactions, you can select heart, you can select clapping hands, you can select toes, you can select anything that you want to give to them just to congratulate them and thank them for an excellent presentation. I learned a lot today, so I'm going to open it up for questions. You can type your questions in. You can unmute yourself and ask questions, and Brown will recognize you, or you can simply talk. Okay, so I have my first question for this group. So you mentioned that there is a high burden of diabetes in the Western, Bernard, I think I found your statistics really, really detailed and very compelling. I think I saw that some of the numbers are higher in developed countries, for example, in Netherlands and so on. So in your group's research, what do you think might be some of the reasons that explain this higher prevalence?
Okay, thank you for that beautiful question. The high prevalence from the developed countries, it could be as a result of diet, nutrition, like kind of lifestyle, because it's other causes of this diabetes. It could be as what we said, kind of a poor economy or something like that, when people don't have access to good nutrition. But for the developed countries, I think the economy is very okay. So it's their own personal lifestyle that could result to the high prevalence among them. I don't know if I've answered the question.
You did. An attendee actually sent a question to me now, and I'm going to read the question. You talk about good nutrition like fruits and vegetables, how can those of us in developing countries really have access to fruits and vegetables? So any of you can take that question. Marilyn, Bernard, you are a global health expert, Ether, or Beverly. So what is the guidance for developing countries, right? In Nigeria, I know in Nigeria, decades ago when I used to live in Nigeria, you could buy fruits, right? You could buy fruit from Jos. Jos used to be a very big source of fruits and vegetables in Nigeria. But beyond Nigeria, Kenya, Ethiopia, South Africa, Cameroon, Senegal, Liberia, how can we encourage, what are some of the strategies that people can be encouraged to eat more fruits and vegetables? And this is not only to the group, any other person here can also weigh in, because we have experts, from across the world on this forum.
Thank you, Dr. Aswin.
Yeah.
Go ahead, Beverly.
Okay. For developing countries, I think one strategy would be education and also taking them back to the rural life. The good thing about developing countries is there's a sharp, I would use Nigeria as an example. There's a sharp contrast between the life in the rural areas and in the urban. In the rural, you have them who they have more farms, they do more farm works, they have, they cultivate vegetables and they eat healthier than in the urban. So with the developing countries, with good education and pointing them to the fact that they could also cultivate theirs, trying to let them see the difference between the urban and rural areas and how they live their lives and how they also eat. I'm sure it will help them cultivate that habit of eating good fruits and vegetables. I say that because I have lived in the two parts of Nigeria, in the rural and in the urban. And I noticed that there's a sharp difference between the kind of foods that are cultivated and eaten in the rural areas against what they have in the urban cities.
Ether, go.
Just to add to what Beverly says, education, she gave an example of Nigeria, the kind of foods. I think when we say fruits, it doesn't mean that everybody has to eat fruits. You have to educate yourself to know the right kind of foods to eat. Originally from Zambia, and what I've noticed of recent years is that because Zambia, we have what we call nshima, that's our main food. People now have become more aware that nshima is not good for your health. So what they've started doing is instead of using cornmeal, they are using foods like millet, sorghum, which are low in carbs, to just substitute for cornmeal, because now they understand the benefits of, millet and sorghum, so it's not just, we are not saying, okay, just eat fruits. But you have to understand which foods are right for your body to avoid diabetes.
Thank you, Etta. Somebody, today, I'm really smart today. An audience member said, thank you, Dr. Zune, for expanding the interpretation of healthcare providers to include pharmacists, include nurses, include physician assistants, include OT, because in some countries, access to healthcare professionals could be limited. But we know as global health professionals, expanding it to include other healthcare professionals like you people here who are well-trained, who will have access to vetted information that they can actually use to educate members of the public. In the age where everybody can go on the internet and search things, it is really important for public health professionals to underline, be able to be the messengers sharing vetted health information. So I'm going to take one more question. How many hands are up? One more response, short response, and then we will go to the next group, which I'm really excited about the next group because they're going to be talking about mental health. Okay, who wants to go? Marilyn.
Thank you, Dr. Aswin. I wanted to add to the previous question about the fruits and vegetables. In some of these developing countries, the climate has an impact on the type of foods and fruits and vegetables that can be grown, and that may impact what the people have access to as far as fresh fruits and vegetables, as well as the resources, the lack of resources in some of these countries. The World Health Organization has made significant attempts to provide food. However, I think there is more of a need for providing the fresh fruits and vegetables, which presents more of a challenge. Thank you.
Fantastic. So everyone, please unmute and join me, and let us give Group 1 a rounding hand of applause. Great work, you guys. Great work. All right, so we are switching now. Please hold your questions to the second group, which is equally an exciting group. I am a big fan of mental health and well-being because I am a believer in the World Health Organization's definition of health, which is complete state of physical and mental health, right? It doesn't say complete state of physical health. It says physical and mental health, and not necessarily the absence of disease. So as global health experts that all of us are, the goal is that we should be driving towards holistic, complete health and wellness for all the individuals and the communities that we work with. It doesn't matter where. It could be in North America, in Sub-Saharan Africa, in Asia, in Latin America. People are people, and as public health professionals, your roles remain the same. So no more talking. Group 2, take it away and let us know how we can improve lives in mental health.
Thank you so much. Hopefully everybody's able to see my screen. Yes, okay. Hi, everyone. So we are going to be talking about mental health and being able to understand it in all capacity, you know, who's affected, you know, what actually is mental health, what, you know, we hear the different terms associated with mindfulness, with mental health disparities and mental health disorders or challenges. So we're definitely going to be talking about that today. But to start off, I wanted to take a moment to introduce ourselves. My name is Jocelyn Rodriguez, and I have a Bachelor's of Science in Exercise Science. And I am currently one of the fellows amongst everybody else with GHEP. And I'll leave it off to whoever else in my team would like to introduce themselves.
Thank you, everyone. My name is Bolaji Odisa. I'm also a fellow with GHET, which is based in Maryland, US. Thank you.
Okay. Hello, everyone. Okay, my name is Chimelogo Ikoakwe. I'm a public health analysis intern at GHEP. Thank you.
Hello, everyone. Please, can you hear me?
Yes, we can hear you.
My name is Simon Boache. I had a Bachelor of Public Health in Disease Control from the University of Health and Life Sciences in Ghana. Currently, I am Public Health Analyst Fellow at the Global Health and Education Project. Thank you.
So now we're going to talk about, you know, what is mental health? You know, breaking it down and understanding by definitions. So mental health is the successful performance of mental health function, resulting in productive activities, fulfilling relationships with others, and the ability to adapt to change and to cope with adversity. So it's our overall mental state. Mental health challenges is the sign and symptoms of insufficient intensity or duration that does not meet the criteria for a mental health disorder, which it tends to be, you know, all of us tend to have those experiences in short-term capacities. It might be due to different reasons, which we'll talk about the different causes to mental health challenges and mental illness and mental disorders. Mental illness is a mental health condition that has a negative effect on the way a person thinks, feels, or behaves. Some of the common causes for mental health challenges and disorders can very much vary for each person. And sometimes it's a combination of different things. Starting with genetics does play a role with the different challenges and disorders that might be in our family. It might be very prevalent to have depression or schizophrenia or something else in our family. It does play a role in our chance of being diagnosed with such challenge or disorder, but there are other things that do play a role, so such as injury or illness, does affect our physical health, which then in turn affects our emotional and mental health. We have all been impacted. I think that is something we can all definitely share here today. We've been impacted by the pandemic of COVID-19 and may still be experiencing some of those, under those ripple effects of the pandemic. I would say that we all did feel, probably afraid, just confused and stressed from all the different things that did come out of the pandemic, which may have constituted us to have had a challenge or maybe a rise of symptoms for a mental disorder. Domestic violence or overall violence in our day-to-day life would increase the possibility of being diagnosed with one of these challenges or disorders, as well as moving to another country, moving to another city or county or whatever it is, just the fact of leaving your home, something that we all may have experienced one way or another, it has also played a big role in overall mental health, especially for those who have had to leave their countries to, for either overall better life or for safety reasons or for whatever other reason it is, that has played a role in seeing the amount of cases in mental health challenges and disorders, as well as stress. We are human beings. We are, we have emotions, we have different things that come up in our day-to-day life due to family, work, or environmental situations, in our government, many other reasons why we could be stressed that also fluctuate our symptoms. Some of the common types of mental health disorders are anxiety, depression, PTSD, eating disorders, substance use disorder, schizophrenia, and OCD. Some of the common myths that we have that are actually related to mental health are that there's a stigma to think that the people with mental health issues are violent, which is a myth, as well as taking pills cures mental health problems. Another myth being recovery from a mental illness is impossible. A person with mental health condition definitely has low intelligence, and mental health condition is a sign of weakness. All of these are myths. You would be very much surprised in which, many people are affected by mental health, and it is a long process, as compared to, if we do have other health issues like hypertension or things like that, where medication as well as lifestyle changes will help, reduce or help lower blood pressure. We have that stigma that a pill might cure mental health, but it's a little bit more complicated because it is the way we think and we feel and the way we behave. So to recap, mental health is a part of everyone. It's something to look after, real and complex, really important, and something you can change. The same way that we all are encouraged to go for our physical appointments, yearly, to just make sure our overall heart and blood work is, healthy, is also important to pay mind that mental health and emotional health is something that we should also check in with ourselves to make sure that we are doing well. And mental health is not a sign of weakness. It is not all in your head, and it is not something that you can just snap out of, and not always a negative thing, and it is not something to be ashamed of. Some of the common treatments for mental health challenges and disorders are starting with lifestyle changes. These are holistic practices, meaning non-pharmaceutical treatments to overall improve our quality of life through supportive relationships, building that sense of community, or joining a community. It might be in your church, it might be part of your school, it might even be a local community group dedicated to a particular mission. Just being mindful that mental health care is important, and that can include just being open and aware to what you are experiencing. A balanced nutrition, it is something that a lot of the way our mind works, is due to chemicals, hormones, and so forth. So providing the proper I guess you could say like engine fuel, which is balanced nutrition, can help promote positive outcomes in our chemical state. Also mindfulness practices, just remembering self-care, doing things that you enjoy and find satisfaction in, and physical activity helps promote, same of those great hormones coming out, those feel-good hormones, as well as improving our overall physical health, which lowers your risk of illness that we discussed also can be a cause for mental health challenges and disorders, as well as quality sleep. There has been a great amount of research done that the sufficient amount of sleep can help improve your mental health, and also just being open to knowing that there are several organizations, professionals who are able to provide those mental health support, like therapists. That is definitely one holistic way. It's just having the conversation can definitely go a long way in terms of your mental health recovery and in promotion. When needed, there is also medication for short-term or long-term usage to address the different symptoms and challenges and disorders that one might be experiencing.
Thank you, Jocelyn. So I'll be presenting who is affected by a mental health challenge. I also present the global burden of mental health illness and mental health disorders, and I also give the economic cost related to mental health. Next slide, please. So who is affected by mental health illness? I might say that mental health doesn't discriminate. Anyone can be affected regardless of your age, your gender, your geography, your income, your race, your religion or spirituality, or your sexual orientation. You can be affected by mental health illness. Next slide, please. So when it comes to mental health illness, we have a specific group of people who are at most risk for developing this kind of mental health illness. Even though everyone has a chance of developing a mental health illness, but people who are exposed to substance, including poverty, violence, disability, inequalities, are at most risk for developing a mental health illness. Poverty because we have seen that inequalities increase risks of mental health illness or mental health disorders, because people in poverty don't have enough money to buy to meet their ends meet, and also have enough housing, and also overcrowded because they are poor. This increase their stress level. Females are at higher risk of developing mental health illness than males, according to WHO 2020. Next slide, please. So what are the global burden of mental health disorder? From addiction to dementia to schizophrenia, almost 1 billion people worldwide suffer from a mental disorder. This represents over 15% of the global population, according to WHO. In the European Union, about 165 million people are affected each year by mental disorders. Mostly this anxiety, mood, and substance use disorder. And overall, more than 50% of the general population in the middle and high income countries will suffer from at least one mental health disorder at some point in their lives. When it comes to the African region, mental, neurological, and substance use conditions make up 6.12% of the total of the disabilities adjusted life years burden in the African region, according to the WHO African region. So looking at this, I must say that mental disorders are by no means limited to a small group of people, but a major public health problem with marked consequences for societies. Next slide, please. So when it comes to mental health disorder, it has economic cost when it comes to dealing with a mental health disorder. Loss of productivity as a result of two of the most common mental disorders, that is anxiety and depression, cost the global economy about 1 trillion each year. So this is statistics from a Lancet Global Health in the year 2020. This is a report from Lancet Global Health. Based on data from 2010 to 2010, the global direct and indirect cost of mental disorder were estimated at $2.5 trillion US. And more importantly, the indirect costs that constitute 1.7 trillion are much higher than the direct cost. But what we normally want to see is if someone is suffering from a mental health disorder, we want to see the cost should be higher than the amount of money that we push to try to help the person from mental health disorder. We want to see it to be much higher than the non-medical cost. But here, this is not the case for mental health. So this contradicts with a key disease such as cardiovascular disease and cancer, because in the cardiovascular disease and other non-communicable disease, the direct costs are much higher than the indirect costs. But in case of for mental health disorders, the indirect cost is, however, higher than the direct cost. So this cost, again, has been projected to 6 trillion by 2030, according to the WHO. So what I can say is mental disorders account for more economic costs than chronic diseases such as cancer, diabetes, malaria, and COVID-19. Next slide. I think, so what are the barriers when it comes to assessing mental health services? So I will leave this one to my colleague, Bolaji, to present on this one. Thank you.
Okay, thank you very much. Can you hear me now?
Yes.
All right. So thank you, Jocelyn and Simon. I think it's important to say it again here that mental health is a non-communicable disease that is gradually taking its place on the global scale. As the fact that it's one of the non-communicable diseases is now having a recognition on the Sustainable Development Goals. People are beginning to see that there is a need to put it at the front burner. So how are we talking about the barriers? Next slide. So it's important for us to look at the social determinants of health. For us to have a coordinated action globally, regionally, and locally, it's important for us to identify what we mean by the factors, barriers that can actually influence, the position of mental health globally and how we address them. Barriers exist. Some are, they have been there for years, not being recognized, but gradually being, made aware of. Some are perceived barriers, and they tend to exist, and to a wide range, they have different levels of impact on access to mental health. So some of these can be at individual level, a group, or institutional, or even at the level of the environment. You can see here, one of the barriers that we can talk about here is the insurance coverage. For the insurance, we all know that the race to universal health coverage is still far behind. And mental health is just one out of the so many, diseases that is being addressed under the health agenda of the Sustainable Development Goals. A good number of people who may not have insurance coverage may be limited in their ability to access, mental health services. Also, the income level is of significant impact. This also can be related to productivity output. So you can imagine someone that earns less but needs to access health services, even despite having enough awareness to access it may be a problem because he may not be able to, cover for the expenses that can come from there. This is also indirectly or directly related to socioeconomic status as well, which is that of the household or at the individual level. Geographic differences also exist where we have cultural diversity. It tends to happen where some particular, cultural groups are, being addressed, or the stigma is also, identified with a particular cultural group because by virtue of their location. The cultural identity and stigma in a very diverse environment, it's important to note that sometimes you find yourself in a situation whereby a particular mental health issue is being identified with a particular culture, and because of that, people find it difficult to come out to even access mental health. Financial factors where people don't even have access to, or they are excluded from a particular form of insurance for for special services, that also impact their ability to access mental health. Next slide. Yeah, thank you. So cultural insensitivity. This is also like a continuation of what I just mentioned. In some places, they do not recognize the importance of mental health, and that could also be a real, a great barrier in the real sense of it. When you look at gender and sex differences, in most cultures, they tend to recognize the male as being, weak when he complains of any form of illness. So identifying that to his strength is a misnomer, and because of that, most men, male gender generally find it difficult to come out and speak up when they have issues. So it looks like the female gender have tend to have more access to mental health. Social network, these are the family and friends, where we have the individuals. It's very important that when you do have a good support system, you are very much, very likely to be able to access, because they will be able to, come in. When you speak out, they want to give you the support necessary, and then, discuss them, and then see how they can, help you to access the required services when necessary. Then awareness is also another key point here where people really do not know. And I think in this sense, compared to the last 10 years, Africa generally, let me use that word, they tend to be on the back burner. The recognition of mental health is not well known until recently. Beyond celebrating World Mental Health Days, you also have other people coming up, to bring up programs that can help people to be aware. So it's something that has to be a factor, and the recognition will help in making people to access when necessary their mental health. Recognition of mental health problems is also one thing that is globally, a factor here, regardless of the gender, or race, or whatever. So it's still somehow dependent on access to education on mental health. So it's also a social determinant. Healthcare delivery context system, this varies from countries to countries, and it's important that these are taken into context. But on a general note, it varies. Why it's worse mostly in the North America, the North America, yes, and some parts of Europe, particularly Eastern Europe and Africa, it's a bit better. But on the overall, the fact remains that mental health globally is still not being well recognized. The progress is painfully slow, and this has to be addressed as soon as possible, so that a lot of people can be recognized and then have access with adequate care. When you look at also geographic differences in availability of mental health care, the specialties varies, and the distribution also varies. A lot of factors can come into play here, but the fact remains that you can be, by virtue of your location, you may not be able to access mental health sometimes. So at this point, the government needs to come in, bring in the political will to see how people can have adequate access to care, regardless of where they are. And then to also talk about power imbalance. This may not be, very common, but in some cultures, or let me say in some particular locations, there is this, perceived cultural insensitivity, which also leads to, the healthcare provider being seen as someone that is not too sensitive enough to listen to those that came to access care, and then they talk down on them. So it reflects a power imbalance, and that will also affect, be a barrier to accessing mental health. On this note, I will hand over to my next colleague. Thank you.
Okay, hello everyone. Chimelogo on the screen.
Go ahead.
Okay. Okay, hello everybody. I'll be talking about the effects of mental health challenges. Yes, actually, mental health, the effects are actually underrated. Yes, it's actually underrated currently. But with recent researches, we are becoming more aware of the effects of these mental health challenges if not treated. So I'll be taking us mental health challenges, how it affects us when untreated. Unattended mental health impacts negatively on the society. Its impacts affect different sectors. It affects our healthcare sector. It affects the business sector. It affects the education sector, the law enforcement and criminal justice system, even both the emergency social services. All this creates enormous social and economic costs, which, like my colleague have previously mentioned, indirect costs. And unaddressed mental health plays a role in the productivity of local businesses and healthcare costs. It also affects the ability of children and youth to succeed in school and lead to family and community disruption. This is just a summary of what I mentioned about on the different sectors it affects. Coming to education, the kids in school, they won't be able to concentrate. When you don't, if not only kids, even adults in school, if there is an unaddressed mental health issue, businesses, it impacts negatively. You see the business running down. The healthcare system, it actually gives us a heavy burden on the healthcare system, especially when it's not addressed as soon as possible. So I guess that's why the reason for this our presentation, the awareness is such an important one. Next slide, please. So in continuation, the unaddressed mental health problem can have an undesirable influence on the local economy, both on the safety of human lives, both on employment. You get a job and you're finding yourself not being steady in the job, having issues because you couldn't identify there is a mental health challenge that needs to be addressed immediately. You understand? Okay, even homelessness as well as poverty, yes. When a mental health problem is unaddressed, I can tell us that it can lead to poverty or income as a whole. So much of the economic burden of the mental health, of the mental illness is not the cost of care, but the loss of income due to unemployment, expenses of social supports, incarceration, and a range of indirect costs due to chronic disability. That's basically all I'm trying to say here. That is the indirect cause due to chronic disability. Okay, next slide, please. I think Jocelyn will continue.
Oh, sorry. Yeah, so wrapping up, understanding mental health, we've heard about its effect not only on ourselves, but on our overall economy and where we live and what are the barriers to that. So now taking kind of like a step back, we know that there is a need for mental health promotion, for mental health awareness. So we're going to talk about very shortly about how can you become an advocate. The best way to be an advocate is starting with you. We cannot pour into other people's cups until we pour into ours first. And a lot of that can include, those same holistic practices that we were talking about, is making sure that we have a good foundation in our emotional and mental health well-being in order to be able to further extend help to others. And that, again, recapping is that balanced nutrition, the community that we are involved with, the physical activity, mindfulness practices, quality sleep, and just making sure that also the resources that are available to yourself about your mental health, and just being able to provide that self-awareness. And when, there might be some arising of symptoms or challenges or different behaviors that you're experiencing, that, is just kind of understanding, like, is there a lot of stress going on? Like, what can I do to kind of decompress? Starting with yourself is one of the best ways to start advocating and promoting mental health. Some other ways to improve health equity and reducing stigma for mental health is correcting the negative language that can cause stigma by sharing accurate information about mental health. So we talked about some of the myths that are often heard in the community regarding mental health. So just being able to, say like, hey, that's not true. Someone who has a mental health disorder does not make them less intelligent. It just is part of, and it's not, who they are, it's just something that they live with. So correcting that negative language and saying, this is a person who lives with schizophrenia, a schizophrenia disorder, as opposed to they are a schizophrenic. So correcting that negative language can definitely go a long way, not only for ourselves, but also for those around us. And it helps reduce the stigma around it. Also practicing engaging conversations with family and friends, and encouraging them to seek out resources like mental health professionals, and just encouraging them that you are there to support, as well as remembering that taking care of your own mental health through self-care practices and beliefs is very much important, as stated in your previous slide. Also remembering that there's different ways you can very much be involved in the promotion of mental health. It does not necessarily, you don't have to be a mental health therapist or a social worker to improve health equity and reducing stigma in mental health, but also, you can definitely learn more about the plans revolving mental health from your elected officials to see how you can become involved. Sometimes they're able to share that information within the public. So, and there's lots of opportunities as maybe a volunteer or a professional to help move that agenda forward. Also advocating for funding, on all levels, local, state, and national, to incorporate culturally linguistic competent guidelines into proposals. Again, that could be just going to your town halls or just seeing what opportunities for speaking about, your needs, the community's needs, and having culturally sensitive material being, released and so forth. That is definitely another way that can help advocate for more funding to be put into health equity regarding mental health. Also becoming involved into things, especially if you're local to GEGP in Maryland here in, Riverdale, being involved in activities like family tree adoption program that can definitely help be one step in moving forward into being part of a community. There's different ways, if you're someone who wants to be part of that environmental health, and this is definitely one opportunity. And there's many other ones, if you're someone who likes to be, to help in services, like maybe, like food distributions and many other things. There's also that, but community doesn't have to be, giving back to the community. It can also be maybe joining a hiking group. If you're someone who loves hiking and being part of, your local church, that alone also provides that sense of community, because we know that the more we are involved in community, it can definitely help improve our mental health state, as well as lowering things like suicide has been, associated, like those who are more involved in community have lower, those communities have lower rates of suicide due to, having their roots and people holding them accountable and checking in on them. Taking a step forward, if you are someone who's very interested in learning more about mental health, there are organizations and groups that you can be a part of to get trainings. For example, the National Council of Mental Health Trainings, or the Mental Health First Aid, is a training that is primarily virtual and open to everyone if you want to become a mental health first aid person, and they have adult and for youth. So you are able to get that professional training and understanding mental health and the possible symptoms that, revolve around it. And if you are, exposed to that, whether it's your family member, professional setting, they do equip you with the strategies, the skills, and the training to be able to learn how to help that person within your scope of practice. Also, catching up and reading into evidence-based literature and visiting websites like the CDC, National Alliance of Mental Health, that is from here in the United States. But each country will have, essentially their own sense of database that has information on mental health. But just making sure that that is from an organization, definitely can give you that knowledge that you can share with others. And then lastly, it's just understanding that there are different global, there's global, national, there's also local assistance for you and for others who are in need of mental health resources or like access to mental health healthcare. That includes your local health departments. If you have a primary care doctor, they are also able to assist with that, either referring you to someone else, or if it is within their scope of practice, they might be able to see what the treatment plan might look like if it is short term. And then just being aware of the hotlines that are available to you can definitely go a long way. For example, in the United States here, we have 988, which is a suicide and crisis lifeline that is multilingual and accessible to everybody, similar to, we call 911 here when there is an emergency. So similar enough, it's they had created 988 to serve a similar purpose to help those in need when experiencing crisis or suicide tendencies or symptoms. And they connect you to someone who can, talk to you and give you also that additional support. So just being aware of those hotlines that are available to you. There might be more resources than you realize. And starting with, if you're really stuck, the best way to go about it is going to your primary care doctor. So that concludes, today's information on mental health. What is it? Who's affected? What can you do about it? And we are open to any questions that, you may have.
Wow. That's all I can say is wow. Honestly, I feel a little bit overwhelmed now with the amount of information that you have shared on mental health awareness, stigmatization, and how each of us can actually be a source of advocates. So I'm going to do an exercise here. Jocelyn and team put in something here. They said the best way to be an advocate is starting with you. So I'm going to be asking people, do you want to be an advocate for mental health? If yes, you can just say yes. If no, you can say no. Please use your chat function. Let's see how many people want to be advocates for mental health. So of course, me, I say yes. I'm checking. Yeah. Yeah. Yes. Yeah. Brown, yes. Yes. Chimaloga, yes. Yes. So I can tell you that regardless of where you are, whether you live in the United States, whether you live in Africa, whether you live in Latin America, mental health illness is a reality. And so the key takeaway from this is that each of us can, regardless of where we are, we can really be advocates. A lot of people are suffering, but they are suffering in silence. A lot of people are at risk, but they do not know the risk. And one of the things that I really believe as public health professionals we can guide people to do is the concept around understanding your family medical history. That can really make a difference for you And you don't have to write this as a thesis. You can ask your mom, you can ask your dad, you can ask your brother, you can ask a sister. And from that, you can get really important information. And then you can leverage that information to craft some preventive opportunities for you. So I just want to thank you all again. Before we take questions, I have 2 questions already here. Can I ask Brown, can everybody who can come on camera so that Brown can get a screen grab of this that we're going to share with all the fellows. This is really a fantastic day. And you can do thumbs up, you can, whatever you want to do, you can do that just to, and this is me with my thumbs up. And Brown, you tell us when you are able to capture that. Done?
Done, but I'm taking the second one now.
Okay.
Again. Done.
Good. So please join me and really give a rounding applause to Group 2 on mental health awareness globally, nationally, and locally. Please. So I have my first question. Somebody chipped in question here from me. The person said in some low and middle income countries, there is a lot of spiritualization of mental health illness, right? I know that all of you here, a number of us are people of faith, right? Regardless of whether you're a Muslim, whether you're a Christian, whether you're Jewish, or whether you're a Buddhist, or whether you have other religions, or you don't even have a religion. But the faith community plays a critical role in and Bolaji, Majid talked about this in social determinants of health. That is where you live, what you do, where you work, right? And the faith community is part of that. However, in many places, actually in United States, I have seen it in United States, mental health illness has been spiritualized. What can we do? And faith is a good thing. It's not a bad thing. But I'm wondering for this group, how can we combine those 2 things? Mental health and still being spiritual people. That's the question I got, and that's really a very good question. So over to you, group.
Okay, I'll be answering that question. Hello, everyone. Okay, so Chimelogo here. For that question, it all boils down on the awareness we are talking about. Actually, people need to know when to draw a line. Yes, we need to know when to draw a line, when is a health issue or when is a spiritual issue. It's understandable that in most part of the world, especially in Africa, yes, in Africa, is being spiritualized, like he said. Yes, it's true. But if we can all go open and let the awareness be created between everyone, I think it will go a long way to help. I can as well tell you that in the past, the diabetes that we talked about on today, if not for colonization, was assumed to be a spiritual issue, yes, until the awareness and educations and researches on needs were done and people are now being open to know that, it is not a spiritual issue. So the same thing can as well come in with mental health. Once the awareness is created globally in rural areas, urban areas, I know it will go a long way to draw that line between your mental health and your spiritual life. I just believe this. Yeah, thank you.
Thank you so much. Etta.
I think she probably answered my question, because the question I had is that in Africa, like we say, perceptions about mental health or mental disorders are normally come from cultural and traditional myths or beliefs. And there have been a lot of studies talking about educating people, telling them mental illness is just like any other disease. People should be able to talk about it openly. They should not be scared to come forward. But from what I see, although a lot has been written encouraging people to come forward, people still don't come forward, or there's nothing practically being done to have programs that actually draw people to programs that will help them come forward or prepare them to accept mental illness, mental disorders, as just like any other disease. So what could be done really from practically to engage communities to get involved in programs that can really help them to overcome some of these myths?
Good question to the team. One thing that I have always advocated in my practice is the concept around holistic health. And for some of you that know GHEP, 2 years ago, we revised our mission to talk about the social determinants of health. And that is the non-medical factors that impact health. We understand that in many communities, even in many families, even here in developed countries, people do not want to talk about mental illness. But if you craft mental health wellness within the concept of holistic health, people are more apt to come forward, right? They can talk about, I have hypertension, you know, and part of that hypertension, I'm having, you know, stress, I'm having anxiety disorder within that overall concept. So, and that also comes into the concept around co-location of healthcare professionals. Rather than having a clinic for mental health, written boldly mental health clinic, and then another clinic written boldly for medical health, we can co-locate healthcare professionals, and then we can have public health professionals in there all working together and not creating any distinction. But I'm going to let the group, that is only me, right? I'm going to let the group, they are the experts that have done this research, to respond. What can we concretely do to address issues around stigma, to address, you know, people not really coming to terms that I can talk about, you know, I have high blood pressure, I'm taking my blood pressure medication, but I don't want to talk about I have anxiety disorder or something like that.
I think I can come in. I think the reason why most of the time global mental health has become a global health issue. First, as a global community, we lack policy when it comes to mental health. In Africa, where I'm coming from, and especially in Ghana, in our country, we don't have a policy, a national policy that regulates mental health. Our focus has only been shifted to the physical health, neglecting that mental health and physical health are intertwined. Mental health can affect physical health, and also physical health and can affect mental health. National policy that when it comes to mental health, we can use to regulate it. And again, we have, when it comes to the mental health personnel, we don't have much in our, we have other specialties. When it comes to mental health as a profession, we lack personnel who support the healthcare system, but these people are few, and even if they are there, the government is not having enough money to employ these people. So we lack personnel. The training aspect of mental health, we lack the training aspect of mental health. We don't train our health personnel, even though we don't have much in our country. But when it comes to the training aspect, when I was going through my public health training, what I realized is that some parts on the way the training about mental health is not much as compared to the physical health, like malaria, how to control malaria, how to prevent malaria, how to control cancer, prevention of cancer, all this communicable and non-communicable disease. They neglect mental health, but I believe that mental health is a key player when it comes to physical health, because when mentally you are not sound, you can be stressful, and this may lead to other physical health issues. So I think we can solve this issue when we train more public health experts and also focus on mental health. And also, if we have a national policy, and so that a national policy that can regulate mental health and also the training aspect of mental health, I think we need to put all this together as a global community. Thank you.
Thank you so much, Simon. There is a question there before, Chidubem, before you go. There is a question we have from Mark Duke, and they ask, are there some kinds of objective data to diagnose mental health? I put that to the group.
Yeah, thank you very much. So I think this question will be answered by saying the data available right now, most of them are relative. And it's due to the fact that because of the increasing recognition for mental health, people are now beginning to have, at a very granular level, data collected at the level of the primary health care. Because the truth is that that is the very basis of which we can have a consolidated data at a national level. Now, this varies from countries to countries. So the data available right now can still be used, but depending on the system of each of these countries that are beginning to do more on mental health. For example, let me take Africa, for example. We cannot say for certain that we have adequate data to tell us for each of these various mental disorders, their prevalence, their incidence. And you've mentioned one of them earlier, that the spiritualization of some of these issues has made it even difficult for people to come out. Because if you don't have adequate data, it will be difficult for you to be able to project or even to know how to address them. But one thing is very, very important here, advocacy, getting the relevant stakeholders involved, community mobilization, having policies that speaks to this, that are actionable, and at the same time, above all, having a government that is willing to invest a lot of resources. It's enough for you to do all these things, but when you do not even have people that can even provide these services, that's even a bigger problem. And that's why Simon mentioned earlier, training has to be done, in a way that is tailored towards provision of the adequate mental health services across various levels, whether primary, secondary, or tertiary, health institutions. That way, there has to be a very strong referral network. So I think that's all I can say. But with time, increasing data collection will help, to be able to decide how to go about addressing most of these mental health issues. Even in the Sustainable Development Goals, the fact remains that it's now that we are mental health is beginning to get recognition by virtue of the fact that some targets were assigned to mental health, under non-communicable disease, under the health goal of Sustainable Development. So it's no longer, a walk in the park. It's now something that deserves, a concerted effort at regional, local, national, and global level. Thank you.
Thank you so much. Chidubem.
Okay, I'm going to make a comment first, then ask a question. So I would chip in on spirituality and mental health. So I was privileged to come across a study, a cross-sectional study that was actually done on African American women, and to see how spirituality plays a role in their releasing themselves as mental, and it was found to be impactful actually, because these African Americans, they believe that when they put their problems in prayers, that God listens to it, and it gives them a sort of relief. So, and that relief is what that we can also get during yoga, meditations and all of that. So it was linked, the relief that prayer gives was linked to the relief and, you know, that yoga and meditation also gives. So the recommendation was, so how do we come to, or how do we bring these other mental health treatments to them in their place of prayers? And I saw some recommendations talking about now using the religious leaders to try to, as you also pray, also do well to seek, also do well to visit your health providers to, you know, to check for health checkups and all of that, because they found out that when they don't do that prayer part and they still go to their health personnel, they will still not feel that relief because they feel they have not taken it to God, and God as the ultimate person have not taken that burden away from them, even when they have visited a health personnel. So they try to reconcile those, both of them to give a holistic approach and treatment to stuff. So that is my comment on the spirituality and mental health. Then my question is, I don't know what do you guys think about cultural diversity of health providers, these mental health providers? How does it impact seeking of mental health services? Thank you.
Thank you so much for your question. I definitely think that cultural representation matters across the board, you know, not just in mental health providers, but in everything that we have. I very much have heard, like, you know, a lot of community members say that they don't go to specific providers because they just don't understand their cultural experiences that they have had. So, you know, I think that there's like an overall need for support of promoting, you know, such field, especially I think that because of like the pandemic, many mental health professionals or many other professionals in service like did step down because it was an overwhelming amount of, you know, workload and things that were happening. So I think that not only I think there's several stages and steps that are required to build more providers that are culturally competent, that being, you know, trainings, being able to funnel opportunities for minority communities, and also the usage of community health workers. I think public health, the pillars very much rely on the usage of, community health workers who are involved in the community, giving them that training to first start of like creating that awareness and the promotion of it, definitely can lead into a domino effect of creating more, hopefully more, representatives of different cultures within the mental health providers. So it is a multi-stepped, thing that we have to do as a society in order to be able to adhere to the different needs that we're hearing from them.
Good points, really good points. So let me take the last point about capacity. One of the reasons why each and every one of you is on this Public Health 360 Fellowship is because we do not have people that look like you and me practicing public health. Although we use the greater bulk and proportion of public health in each of our countries, people like you and me are very, very small in terms of our representation in public health workforce. And so it is important to have your voices represented, not only your voices, but have your ethnicity, have your races, have your orientation represented, so that when you are there at the table, there is a saying in the United States that if you are not at the table, you will be on the table. In other words, if you are not part of those making those policies, part of those discussing those policies, you will be the person whose policy will be discussed. and you do not want your policy about you to be done in your absence. So this is really serious. Each of you are going to go at the end of this program and become those pillars, those representative for your culture, for your community, and that is really critical. So let me answer one question about, are there really objective ways of diagnosing mental health illness, right? I think that is one question that has always come up, where people think that mental health diagnosis is nebulous. So there is actually a tool that has been developed to diagnose mental health illness. It is called the Diagnostic and Statistical Manual of Mental Disorders, DSM. You know, you'll be hearing people talk about the DSM, the DSM, the DSM. Just like you have in medical diagnosis where you have diagnostic codes, there are actually diagnostic codes and diagnostic criteria for mental health illness. You can really determine based on this characteristic, on this characteristic, on this characteristic, that this person has anxiety disorder, that this person has a stress disorder. Each and every one of us have stress. You need normal stress in order to do these presentations you did today. You need some normal stress to be able to push that adrenaline, right? When you are when you are interviewing for top level positions, you have normal stress, you know, to do those. But the line gets crossed when that stress becomes debilitating, that it is impacting your activities of daily life. And therefore, there is a diagnosis that could be made. So I think for McDuke, there is a diagnostic criteria for determining that somebody has mental health illness. So please, that's another myth. When people say there is actually no diagnosis for mental health, there is some subjectivity, but there are concrete ways of diagnosing mental health illness. You know, when you see people having auditory hallucinations, there is an illness there. And people who are experts in neuroscience have also demonstrated some changes in the chemical components of the neuroscientific component that really culminate in this mental health disorder. So there is, but I'm looking at the time, we have 12:42. I want to give at least one person or two people from each of the groups the opportunity to give final concluding remarks before we adjourn for this meeting. So group one, just one quick remark about the experience, about the outreach and awareness today.
Bernard, would you like to give the comment for us, or Etta, or Beverly?
Okay.
Let
Thank you
Bernard
so
go
much.
ahead. Let Bernard go ahead. Bernard, go ahead.
Okay.
Okay, it has really been a fantastic journey. I learned a lot. Now, the teamwork and the experience is a whole lot of a new experience to me, and it's something that I can recommend everyone to join this program, because if this is just a small part of a project, I'm just looking forward how the bigger project looks like. So overall, I enjoyed a whole lot of experience. Thank you.
Thank you, Bernard. Group two.
Yeah, okay. I think it's a capital yes for me. Within the past 10 minutes, I've received questions from private WhatsApps and from WhatsApp groups where I have some community of people that are already here in this, and they were already asking how can they be a part of it. They're already becoming like, yeah, I think this is the right place for us to go. So I told them, no problem, you will get the invitation and you join the next part. But the truth is that with my experience right now, I've learned a lot, and knowledge, you know, it's something that you keep learning over time, and then you apply it. That's one of the critical aspects. So it's a good experience, and I would like to also extend it to my community so that we can have more people getting involved and impacting in the world where we have emerging, you know, diseases coming from right, left, and center. Thank you.
Thank you, everyone. On behalf of faculty here, I would like to extend congratulations to each and every one of you for terrific job. I want you to understand that regardless of which part of the world that you are from, you can be an agent of social change in your community, in your family, beginning from you. And you are not in Public Health 360 by accident. You are here intentionally. And the intention is that you are going to go back and give back. So think about how we can extend the work that you have presented today. Think about global coordination collaborations that we can use to even pilot some of the thoughts, some of the ideas that have come in here. You come from different parts of the world, and that should actually be an advantage for you to create a network. So on that note, I would like to thank everyone. I would like to thank our guests for joining us and staying with us. And I'm looking forward to greater things that will come as you go on to design your programs. Have a wonderful day, and may God continue to bless